we want to dive into a really serious mental health subject and a treatment option that some people are turning to, that many people may not know about, and others have turned to in desperation to try to help them with their depression issue. We know that youth mental health is a crisis in this country. Latest numbers from the Centers for Disease Control shows that 4 in 10 students, they report feeling sad or hopeless. CDC says 2 in 10 have seriously considered suicide, and nearly 1 in 10 have actually attempted it. And a new article in USA Today says more and more parents are now turning to a treatment for their children called ketamine, even though it is controversial, trying it for their teenagers. Rachel Hale wrote the piece. She covers youth mental health for USA Today. Rachel, thanks for being here this morning on Connecting America. We appreciate it. Explain to us what ketamine is and how it works to try to help depression.
So, ketamine as a chemical works by stimulating the brain's resilience mechanisms. The chemical targets a different part of the brain than standard antidepressants and triggers the release of glutamate, which helps with new growth between brain cells. So, it helps with that plasticity that's impacted during depression.
Why do you think it got so popular as a therapy for young people?
I think that as young people's mental health has started to plummet, more and more parents are kind of at their wits' end. And the parents that I spoke with had tried at least 2 or 3 other interventions before this. The majority of ketamine users are in their early 30s, if not older. So it is a minority that are in their teens. But I spoke with clinics who said they're administering to people over 14.
That's right. And this is an off label use of it. And usually this is treatment resistant depression that we're looking at. She's absolutely correct that parents are at the wits' end. What should they do? So this has to be carefully monitored by physicians. And what would you say would be the role of psychotherapy as an adjunct with this ketamine use?
So, experts that I spoke with said that typically the ketamine therapy is one small part of a larger treatment. So, that's one popular intervention to go along with it, as well as continuing on the standard oral antidepressant if someone was on that before, and talk therapy. So, always that this is only one part of a larger system and that it's going to be monitored.
And it can be abused. There's a risk of addiction, right? We remember Matthew Perry actually overdosed from ketamine, and people are facing charges as a result. Elon Musk saying he has a ketamine prescription, and has used it as well. Um, Explain to us how this is used. This is given intravenously, as I understand it, and it's done in a number of sessions.
Yes, the 2 most popular ways for it to be administered is through IV or through esketamine, which is a nasal spray. That esketamine was FDA approved in 2019 and is the only FDA approved form of ketamine therapy. But typically, for those who use the IV form, it's going to be a 40-minute session administered at a clinic. And typically, there will be a series of 6 first sessions, and those will usually happen within at least a few weeks, if not within a few days of each other. And then most people continue on with maintenance sessions every 6 months or so. But it, of course, depends on the person and the amount that they need.
You think ultimately it's worth the risk?
The experts that I spoke with said that there's still too little research to make a fair judgment about the risk for young people, but that ultimately they think the risks involved with ketamine therapy, if administered safely, pales in comparison to the status quo that these people are living, pales in comparison to the effects of growing up with treatment resistant depression.
You spoke to some who have used it. What did they tell you?
They told me that they found it really helped with their OCD, depression, and in one case, a young woman who had lost both her parents also used it to address the grief in her life. And the people that I spoke with, they were 16 and 23 at the time that they used ketamine, so kind of both in that range of young users. And they found that it was a really helpful addition to the current treatment that they were doing. But the 16-year-old did tell me that even now, she's now 19, she wonders if she was too young and sometimes thinks if there were other things she could have tried.
Are they using esketamine for young people? My understanding is it's something, and the
That's the
name,
nasal spray.
the nasal spray, Spravato, I believe, is something that should just be used for adults. And what is the potential for abuse for young people?
So neither is FDA approved for anyone under 18. So the majority of the therapy is administered through off-label IV use. So most of the teens or young people who are using it are using that IV form because that's what most clinics administer. The potential for addiction, the young brain under 25 is not fully developed, so it's
That's
already more
correct.
prone to addiction, and some of those concerns rise for young people using ketamine.
All right, Rachel Hale, we thank you for joining us. Very interesting article that you've posted on USA Today. We appreciate you joining us here on Connecting America. So much to digest with this. People who feel that nothing else has worked, Dr. Jeff,
Yeah.
are desperate to try anything. How do you feel about that attempt to maybe try something new?
Well,
And
it's
who should you talk to
Yeah.
first?
Well, of course, you should talk to your physician,
Yeah.
your psychiatrist, perhaps a mental health expert, psychologist. But the important thing here is, again, this is for individuals, youngsters that we're talking about here, that they have taken other
Mhm.
antidepressants, other anti anxiety medications, and they have not worked at all. And as Rachel has pointed out, which is really important, this isn't something that you use just the medication, but it's part of a broader treatment protocol that also utilizes psychotherapy. Remember, these medications just treat the symptoms, but they don't cure the illness, and therefore it's important to get to the base of the foundation of what's causing the depression and the anxiety, and you do that through therapy.
To follow up on that, there's been an increasing mental health crisis with our youth. Why do you think that's happening?
Well, certainly we know that the pandemic has really turned the world upside down. And so we see an increase in the statistics of adults and youngsters who are having mental health issues. Depression and anxiety has absolutely risen for both populations. But we're also in a time with a lot of global tension, a lot of global issues, as we talk about here on Connecting America. And young people hear this. They know that the world is upside down, and they feel that in many ways that they're very, very isolated. People can look to social media as playing a part of that. Isolation is part of that. So it's really important that we listen to our children and not be afraid to actually enroll them in some sort of psychotherapy. And I'd like to see more being done as far as having mental health programs in our schools, which also includes some evaluations once kids are referred. We shouldn't be afraid of dealing with our children and their mental health issues,
Mhm.
because the bottom line is the quicker you get in there to work with them, the better the outcome will be.
And there are so many resources out there. If you have a child or you yourself as a young teenager are struggling with serious mental health issues, I know I've done some work with the JED Foundation, which helps
Mhm.
to raise awareness about suicide in young people. So, go to their websites, read in and see where the help is, and they provide resources as well. Really important thing to do.
I just say to parents all the time, if God forbid your child fell down and broke their arm, you would take them to see a physician. So if you believe that your child, or if your child tells you that they're going through emotional conflicts, it's really important to get them therapy. And I'll say this, I have a 10-year-old who asked to go to therapy, probably because I'm her father and it's difficult to live with me, but
No.
she's also gaining so much from it as far as self-awareness. Not that she had any depression or anxiety, but she just wanted to talk to someone about her life. And I think that's absolutely fantastic.
Well, she's lucky to have you as a dad.
Oh, well,
Absolutely.
thank you. You have to talk to my wife about that.
All right.